Hello there, everyone. Are you someone like me who struggles to fall asleep at night, stay asleep, is a bit of a light sleeper, or someone who needs more naps in during the day? Then Manta has the products for you. Manta sent me a couple of their sleep masks that I've been using for the past couple of months, and these have saved my sleep. I am an excruciatingly light sleeper, so if I see any lights or distractions, I'll wake up and stay awake. And the Manta sleep mask has blocked out all the light to help me have some of the deepest sleep I've ever had. I'm currently using the Manta sleep mask in silk with the Manta eye cups in silk because this is some of the most soft and cozy sleep masks that are really breathable, super adjustable, prevent wrinkles and bed creases while you sleep. And the silk is just so luxurious. It's so soft and I fall asleep in a snap. So, what are you waiting for? Get your Manta products, link in the description. Sleep better anywhere, anytime with Manta. Thank you, Manta, and have yourself a great night. And let's check this next patient. Okay, looks like they're sleeping. Whoa, that is one eye, and just one eye. Okay, we may have our anomaly patient for the evening. I've never seen just one eye before. Okay, I don't see a second one either. Just one, and there appears to be one eyebrow as well. Okay. That kind of reminds me of Futurama, but I've actually read about this before, so it can be quite common in comparison to other things. Okay, and let's see their report here from the nurse. The nurse said, okay, that they fell down and one of their apartment neighbors called them in. Okay, no information on their name though, just that they fell. Okay, and because they're asleep, I'm just gonna wake them first. Okay, let's see here. Hello there. Sorry to wake you. Hi there. Welcome to Dream City Clinic. I am Dr. Luna. I am the head doctor here for our night clinic. Welcome. Yes, welcome indeed. So, you've been sent here today by one of your neighbors. Do you remember what happened? You were feeling a bit tired all day. Okay. Any signs of cold or flu? Okay, stomach ache, headache, nausea, pain, upset stomach, fever, chills? Okay, none of that. What about signs of mental health or exhaustion? And it's okay, we don't tell any of this information, but it's okay to be telling us the truth, okay? Pretty tired? Okay, that's understandable. And quick question, has anyone ever seen you about your eye? Yes, you do have one beautiful eye, but sometimes one eyes can lead to some complications, and I'm just wondering if anyone's seen you for that before. No. Okay, well, we'll see you here today for that. Ever been to a hospital before? Found no ID on you? No, you don't have your ID with you on you anyways. Okay. And could I just get your name? Okay, now how do you spell that? AX3. Okay. How do you pronounce that? Okay, Ash. What about your last name? 1337. Okay, and when's your birthday? The 1st of January, what year? 2000. Okay, sounds kind of like one of those birthdays I always put in when I create a new email. But if you say so. Okay, and I'm just going to give you something we call a comprehensive full body exam, okay? I don't have your information in our systems, and you said you've never seen a doctor before or been to a hospital. Yeah, so we're going to ask you for more information after I give you an exam, but your health is our number one priority right now, okay? So what this consists of is a full physical, and some analytical tests to see if your comprehension and wellness match up to your health, okay? So, first I'm going to ask you with your one beautiful eye here. Could you look at me? Good. Can you look right here? And could you look right here? Look above. Look below. Can you close your eye? Can you open it? Close your eye again. And open it. Okay? And can you look all the way over here? Look all the way over here. Look above. And look below. Look below. Very good. So it looks like your eye is working properly. And have you been overworking yourself recently? I understand. So I'm just going to first get some vitals for you, okay? I'm going to first get your temperature. Can you hold still? Thank you. Just hold still. Now, have you ever, you said you weren't having a fever, correct? Okay, well, I'm going to check this one more time. It says you were running a fever of about, it's like 38 degrees centigrade, which is quite high. I'm wondering if the lights are bothering you or if you're sweating a bit. No. Okay, well that is just a very, very, very high temperature for someone to be running. I'm just gonna write that down really carefully. Maybe our machines could be down. Do you have any electronic pieces in your body that could be interfering with my equipment? Not that you know of. Okay. So I'm gonna actually test your finger first. I have something called a pulse oximeter. I'm gonna be putting a little clip on your finger, okay? So I have it here. Could you give me your finger? Good, I'm just going to clip that in. It's going to get a little bit of your pulse and your blood pressure. We're gonna wait for 5, 4, 3, 2, and 1. And let's check right here with the results. Okay, that doesn't work. Let me get my other one. I've never actually had to use my better pulse oximeter. Let's try again with my other one. Give me your first finger now. Okay, hold for 5, 4, 3, 2, 1. Pull it back. And the pulse oximeter read as null. I'm gonna get your pulse myself, okay? Are you someone who's a bit nervous or sweats a lot? Sometimes I can just throw out the results. So, I'm just gonna check your pulse, okay? This could be a bit cold, so just relax. So, I'm gonna put this right on your chest and breathe calm, okay? Let's try this out. Okay, let's try the other side. Okay, do you know if you've ever had something known as pneumonia or some sort of lung difficulties? Yeah, I'm just sensing a lot of heavy breathing and I can't sense your heartbeat. Let's try this again, okay? Okay, right here. Okay, let's try this again. Let's test your back. I'm going to test your breathing, okay? Breathe in. Okay, let's test the other side. Breathe in. Okay, so I'm sensing that there's a lot of blockage in your lungs. And I personally could hear 3 or 4 heart chambers, which typically you can hear 1. So I'm guessing that there might be some sort of flaw right now with our equipment. Do you know if you have multiple heart chambers or some sort of condition? I've just never seen that before. No idea. Okay, so 1 eye, multiple heart conditions here. Okay, I'm just gonna manually get the temperature from your body, okay? I'm gonna put my hand right on your wrist and get your pulse. I'm gonna take your temperature just with my hand, okay? So just relax, okay? May I touch your face? Thank you. And breathe. you are very, very warm right now. So I'm actually going to ask that someone comes in afterwards and gets something for that, okay? But no worries. What I'm going to do is we're going to do something where we just count limbs, okay? I do notice that you have one eye here. I'm going to ask you to just follow my little cotton swab here. And with your eye, just look. And follow it. Good. And follow it. Good. Okay. So, I do see that we have one eye here. We do have one nose right below with two nostrils. We do have a mouth, okay? Can you open up your mouth for me? Okay, I'm gonna get just a couple of tools here. I don't think I've ever seen that many teeth before. So, I'm gonna get this nice little cotton round, okay? And with this light here, I'm just gonna look right into your mouth, okay? Open your mouth and say, ah. Okay, and I'm counting roughly around, that looks to be about 20 teeth on the bottom. And looking at the top teeth, it looks like about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 25 teeth on the top. So you are pulling at around 45 teeth. Your smile is beautiful, but the back of your teeth have more teeth than I have ever seen before in a human's mouth, okay? So, could you smile for me really quickly? Okay, like this. And you go, ah. Oh my goodness, I did not see that either. Let's pull the light back up. Ah. Two uvula. And then keep your mouth open. And 4 tonsils. 2 uvula, 4 tonsils, and 45 teeth. Okay, I've just never seen that before. Do you know if any of your parents had conditions that were similar to yours, or any siblings, family members? No idea. Okay. Have you ever met them? No, that's okay. No worries. Just wanted to just explain more about what happened to you today, okay? Now, comprehensive exam includes just a little bit more. I'm going to just sense to see if you have ears, okay? And it looks like you have one ear here and one ear here, though they are quite small ears. Do you have any problems hearing? Okay, just gonna see right there, okay. Okay. And let's look right down from your ears all the way to the back, right there. Any pressure? Okay, can you hear this? Can you hear this? Okay. I'm gonna ask you to close your eyes. I want you to let me know which side I'm whispering from your ear on, okay? So, I'm gonna go to one side and whisper something, okay? Pomegranate. Can you repeat back to me what I just whispered to your ear? Pomegranate, okay? And what side did that come from? Opposite side. Okay, let's try this side. Twilight. And what side did that come from? The opposite side. And what word was that? Twilight, okay. So you have flipped hearing as well. I'm going to just test that really quick if that's okay with you. Okay. So, put my hands right behind your ears and let me know which side you hear it from, your left or your right side, okay? And what side was that on? Okay, flipped. And what side was that on? Flipped. Okay, I wonder what that could be about. Have you ever been someone who loses their balance easily, or perhaps looks the opposite direction someone's calling you from? No, not really. Wow. Looks like you have very good health then. Sometimes I get confused, even when I hear things from the left or the right side from the proper sides. Okay. I'm just going to quickly test your eyes, okay? So, with my pen light, I'm going to test this one eye that you have here. I'm going to get a bit up close and I'm going to look right at the color of your eye. Your eye looks to be an amber, not necessarily a brown, but kind of a red. Do you have any conditions that would cause that? Because amber eyes are quite rare. Okay, not that you know of. I'm going to cover part of this one eye. I'm going to keep looking at it just to see if it dilates properly. Good, thank you. So I'm going to cover this other part of your eye and shine it like so. Perfect, okay. So it appears that when I shine the light into your eye, one part of your eye goes amber and the other part goes a bit purple. Perhaps it could be a mix between the red and the blue part of your eye. It's a very unique color. I've never seen that before. Yeah, I've never seen that before. I'm going to take a note of this down because that's quite interesting. Your eye does dilate properly with light showing inside of it, but the color changes to some sort of amber red and purple, which I've never seen before. Let's just see there. You know what blood type you are? Okay, we might have to run some tests on that afterwards to see what you could be. I would be very surprised to find out what I could see. Okay, so I'm going to ask you really quickly to do something called follow the light. And with your eye, keep your eye still. Don't move your head or your neck, but just with your eye, look directions and follow the light, okay? Is the light most bright here or to the side? Unable to tell, okay? What about now? A bit to the side? That could be because of the refraction of this beautiful eye that you have. Okay? One eye, okay. When you sleep, do you keep one eye open? Okay. Does that bother you at all? Okay. So, I'm going to just quickly test the parameter of your eye, okay? One more time. Does the parameter of your eye end right here? Here? There. And what about above? Here? Or here? Okay. And will you let me know which hand gets out of your parameter of your vision first? Okay. 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 Interesting. So the parameter of your vision is quite large, so you can see that just with one eye. Interesting, okay? Now what I'm going to do is I'm going to get my tool bag and we're going to start looking at things and counting your body parts again, okay? So looking right at you, we do see we have one eyebrow, one main eye, a nose, a mouth with 45 teeth. We have 2 ears which have flipped hearing, 2 uvula, 4 tonsils, and you do have a normal tongue. I saw that, which was fine, but I'm not too sure what the necessary steps would be for having more of that. Okay, now I'm going to just see right here, it looks like we have 2 collarbones, and we have 2 shoulder blades. I'm going to feel right underneath your neck to feel your lymph nodes, okay? So just a little bit of pressure here. Let's try that again. Could you lift your head just a bit up for me? I'm going to put more pressure right there underneath your neck and your chin. I'm feeling 4 solid lymph nodes that are a bit swollen here. Okay, maybe that's why you have such a high fever right now. Have you been in contact with anyone who's been sick or been out in public? Yeah, okay. Okay, you can relax now. Just relax yourself, okay? And I'm going to ask you to do something for me. Ask you to lift your hands up like so, okay? Lift your hands up. I'm going to count your fingers, okay? We're looking at 1, 2, 3, 4, 5, 6. Is that correct? Keep your hands up. 1, 2, 3, 4, 5, 6. Yeah, you have like an extra pinky finger. Okay, let's try the other hand. 1, 2, 3, 4, 5, 6, 7. One more time. 1, 2, 3, 4, 5, 6, 7. You have a total of about 13 fingers total. Have you had these your whole life? You have. Okay, 13 fingers total. I'm just gonna write that down, okay? And out of curiosity, can you move all your fingers for me? Okay, just mimic me and move all your fingers like that. Good. Wow, you have full control of all your fingers. That's awesome. I bet you'd be amazing at piano. Now, I'm going to ask you, raise one hand and close it. Raise the other hand and close it. I'm going to ask you to give me a shake and squeeze my hand as tight as possible, okay? So 3, 2, 1, give me a shake. Oh, yes. Perfect. Your muscles are working great. Other hand. 3, 2, 1, and give me a shake. Squeeze my hand as strong as possible. Oh yeah, that's great. Muscles are working great. So it looks like we have 2 lateral muscles and we have 2 main arm muscles. And it doesn't look like you have anything in predicament that I could see. Could I just run my hand down your arms? Okay, nothing wrong with the muscles here. No bruises that you feel. Okay, right onto the elbow. Do you have 2 elbow bones? Okay. Can you try to keep your arm straight for me? Good. Can you lift your arm out and keep it straight? And do you have any multi-flexibility points where you could go beyond that? Okay. Keep your arm down now. I see that you have a lot of flexibility with your arm. Okay, let's try the other arm now. Now I'm going to just feel really quick to see if there's another elbow. There is 2 elbows there. Can you lift your arm out and see if it's straight for me? Good. And can you bend it back a bit more as if you had more flexibility? Yeah. Okay, you can let that down and relax. Does that hurt you when you do that? Yeah, so let me show you how your arm is doing. A normal arm goes at this type of angle, where because we have our muscular bones on our bones like this, it stops us from doing that. Your arm would go beyond that and go as if we're bending down like this, but it bends down like that. That is a lot of flexibility in your arms. Again, another anomaly I have never seen before. It looks like both of your arms have that, which is honestly very amazing. You're probably really good at sports. So let's move down. I'm going to put a bit of pressure on your stomach now, okay? And let me know if that feels uncomfortable, okay? Okay. Just a bit of pressure and relax. Any pain? A bit of pressure. Relax. No pain. One more time. A bit of pressure and relax. No pain. Okay. Have you been eating well? Okay. And do you have any type of food allergies or something that you can't eat? Okay. Okay, that's quite normal. That is a quite normal allergy. So almonds, cashews, peanuts. Okay. Anything else that you know of? Any allergies to medicines? No idea. Okay. Let's see your knees and your legs. Okay. I'm just gonna check your knee really fast and your leg. Any pain here in your thigh? No. You have 2 knees. So you do have 2 knees, so 2 kneecaps on both sides. Do you have the same flexibility as you do your arm? Okay, can you put your leg out flat? And can you lift it more? Oh my goodness, okay, relax. And what about your other leg? Let's feel. Any bruises or pain? No, and 2 kneecaps. Can you lift your leg up again? And can you flex it? Wow, okay, so it does look like you do have 2 kneecaps and the flexibility is still there. Okay, let's check your feet. And I'm gonna ask you, can you move your foot around like this? Just move your foot around. Good, and can you move your foot around on this side? Good, and let's quickly count your toes, okay? So it looks like we have 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 8 toes. Let's test the other one. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay, so 8 and 6. You have about 14 toes. So 14 toes and extra pinky toes are not like normal big toes. They kind of wrap around the foot. Again, I think you'd be amazing at running or some really good sports. You have a lot of utility there that could be very helpful to you. Have you ever had any problems with your feet or finding shoes? A bit? Okay, I'm going to recommend some shoes for you, especially because your toes look healthy and in good condition, but I've just never seen that many toes or fingers before, so it looks like we have a lot of phalanges. Yes, we do. So, especially for your lungs, and because you did fall down, perhaps due to exhaustion. When was the last time you ate? Do you remember? 2 p.m. of the day prior? Yeah, so sometimes if we're actually overexerting ourselves or feeling a bit anxious, we can just fall down or feel uncomfortable out of nowhere, okay? And I'm going to ask to just do some more testing on you if you would allow us to. I would love to take a look at your lungs and get just some sort of scan to check to make sure that there's no bacteria there. And I'd like to get a couple samples of just your saliva really carefully so that I can just to make sure that there's no bacterial infection, okay? And then, just because I did see that you had just a couple of breathing things, we'd like to keep you in overnight just to make sure that nothing gets worse, okay? Does that sound good for you? Okay, And especially because I've just never seen someone with that many limbs before. I've just never seen that before. Would it be okay that I ask you for a bit more information later when you relax? Okay, thank you so much. So, it's just that I've just never seen this before. So, thank you so much. Okay, have yourself a good day, and I will see you in a little bit with your results, especially to see if you have any bacterial information or whatever, okay? Good. Thank you. Yeah, thank you. You're going to help us with our studies a lot.